Hello, my name is Anjane, and I'm trying to make this video to share my perspective as a kidney donor. So all the questions that I had, or probably you might have as a donor, I will try to cover. This includes the pre-surgery, on the day of surgery, what happened, and post-surgery experience. Today I have completed 3 weeks from the day of surgery. The surgery was on 29th of December 2022 in JP Hospital, Noida, India. And I gave my kidney to my brother, and he had a kidney failure. So before surgery aspect, things I did to keep my body in shape and check was I was drinking a lot of water for like a month and a half. I tried to prepare my body to drink a lot of water, walk a lot, kept my weight in check, try to make sure that you do not have any pre-existing condition like blood pressure or diabetes or something like that. Before surgery, there is a lot of tests that are done on you to make sure you are a right match and compatible. So I went through almost like 23 tests. Most of them were blood related. Some of them were not blood related. Like they take ECG, echo, CT angio, CT scans, ultrasound. There is one test called DTPA renal. For some tests, you might have to fast if you're giving blood sample for checking the sugar level, but mostly they are very simple. You just have to give blood samples. There's one test in which you have to give a 24-hour of urine sample. And basically how it works is that you start in the morning, you go first time to the toilet, that sample is discarded. And from second onwards till the next morning first, you collect all your urine in the jar and you submit that jar for the testing. Also make sure you drink a lot of water on that day when you're collecting. Apart from that, there is DNA level test. There's also psychiatric test that happens to make sure that you are doing with consciousness and you're informed about the consequences, what happens, you completely agree, what's your motivation behind this. So it was very thorough process. It was very thorough process. So this was pre-surgery. All the tests took me approximately 7 to 10 days to complete and get the reports. And then there is also one interview that get conducted with the medical officers who come on camera. They record the relationship between the two, the recipient and the donor. They ask you questions about why are you doing that, who you are, how are you related. They make like a family tree as well to understand who's related to whom. They have a witness, your dad. In my case, it was my dad who was present there. Then they also ask for evidences, photo evidences to confirm that you are related. So I had to submit photographs from last like 10 years where I have me and my brother and the witness in the same picture, things like that. So that's one aspect you have to also do as a prerequisite. On the day of surgery, so 2 days before the surgery, my brother was admitted into the hospital, and 1 day before I was admitted. So if tomorrow is the surgery, today I was admitted. And then they basically just keep you on check, everything is fine. On the day of surgery, the surgery was approximately 4 hours for me. So I went into the pre-OT where they give you anesthesia around 9:15 in the morning. And I came out around 1:15, 1:20 something. First, the donor gives the kidney, and then they take the recipient, and then they attach the kidney to the recipient. What kind of surgery I had? So there is 2 possibility of surgery. One is called laparoscopy. The other one is called open nephrectomy, something like that. I did not know there is a difference. So if you usually people give their left kidney, and for that they do laparoscopy. And what happens in laparoscopy is that they put small holes in your like abdomen on the left hand side, and they put a small incision close to your navel. It's like 3 to 4 inch. It's not big. And from there they disconnect the artery and they put that to the recipient. But in my case, I had 2 arteries on my left kidney. So the doctor preferred to take the right one. For that, I had the open surgery. For that, I had an incision from here till here, like a bit longer one than the left side. So basically, what's the difference? The difference is the incision is longer. The pain might be slightly longer. The recovery would be slightly slower, but the effect of kidney transplant is same. So for the recipient, which is basically what matters, is the same. It's equally successful. There is no difference as such from that perspective. At least I didn't feel so. Also, the pain is not that much. Obviously, there will be a lot of pain, but that's anticipated from the surgery. And then I was put into ICU for next 4 days, and on the 5th day I was discharged from the ICU to home. And between these 4 days, the first day they don't give you any food, any solid food. You are on IV. From second day onwards, you can drink a little bit of water. They closely monitor all your vitals, fever, blood sugar, blood sample, kidney function, everything. And same for the recipient as well. What else happened was, I celebrated New Year in the ICU. So that happened. Also, so on the day of discharge, they basically give you kind of a follow-up. So I got discharged on the 5th day. And then after 5 days, I had to meet the doctor for checking my basically stitches and the status and medicines. For these 5 days, I was given antibiotics, some laxatives, some medicines for in case I have pain, which you will have. Also, it's very important that you remember all your life not to take too many painkillers without consulting doctors, because if you take a painkiller, very strong painkiller, and you don't consult, that can affect your kidney. So be careful about that you have to always check with the doctor. Always inform them that you have one kidney, so they take all the precautions in future. I could slowly start to walk. Try to make sure that you do not walk too much, and also you do not stay on the bed too long. So basically what it means is that I try to walk around the house, inside the house a little, to keep myself active. It hurts a lot, but slowly it will recover. There is one problem that happened with me, and I asked other patients as well, is that you might not have like clean motion from your stomach. So basically they give you some kind of syrup, some laxatives. I tried to use a lot of fiber in my diet to normalize that. So maybe for the first 10 days I had problem. From the 11th day onwards, it was way better. It was very normalized. Like today is week 3, almost 21, 22 days. And I still have some pain when I walk in certain ways, but it's getting actually better every day from the previous day. And I feel stronger and I can do things. Also, I have to be very careful about lifting weights. So no exercise, no lifting weights, no yoga. Don't exhaust yourself. Don't walk too much. And you have to eat fresh food, homemade food. No outside food for next 2 weeks. Like from the day of surgery, 2 weeks, you don't have to eat outside food. The food that's made now, you eat now. Then, so if there is some, let's say, atta left from the morning, don't eat it in the afternoon. So hygiene is very important. About the recipient, he has to also, after being discharged, maintain a lot of hygiene. So for the first 3 to 6 months, depending upon the kind of surgery they had and the doctor's recommendation, they have to isolate themselves. Only one person is allowed to meet them, take care of them. Their room should be cleaned every day. The bathroom should be separate. No one else should use that toilet. The water should be either boiled from RO, so RO water boiled and then cooled down and then given, or like Bisleri water or something like that should be given, basically mineral water. Hygiene is extremely important because they are given immunosuppressant. So basically their immunity is almost close to nil. So even a slight infection can be very dangerous for them. So, and you have to monitor their fever, their sugar every day. So a diabetic test, blood pressure test every day. And the same applies for the donor as well. You should monitor your blood pressure frequently and also your sugar level frequently. My stitches were opened on the 10th day from the surgery. And after the stitches got opened, I felt way better and it was very comfortable to walk and stand. Make sure you don't do one mistake of using any kind of warm water bags around your surgical area, because you have stitches not just outside, also inside. So don't do that. I think that mostly covers everything. If you have any question, feel free to ask. I'll try my best to answer. This is all my personal experience. So just do not over research. Despite I'm making this video, do not over research. If you made a decision, stick to that. If you have any questions, just ask your doctor. Or if you can find contacts of other donors or other recipients, ask their experience. I called few people to ask their experience and ask all my questions. Be positive, be grateful, and all the very best. Thank you. Namaste.